We are pleased to have the opportunity to present our poster to you today, focused on findings obtained through our ITP Natural History Study Registry. Our study is titled Impact of Therapy Choice on Fatigue in Adults with Immune Thrombocytopenia. Our disclosures. The goal of our study was to compare self-reported fatigue and its impact among adult patients with ITP to determine whether fatigue levels differ depending on treatment status. Adults are defined in this study as individuals over the age of 18 years in any phase of ITP. This was a prospective cohort study, and in this study, adult ITP patients were separated into different groups: those who had never received treatment in the past for their ITP, those who had received medicinal treatment for their ITP but not within the last 6 months, and those who are currently receiving treatment for their ITP or had treatment within the last 6 months. This group was further subdivided into those receiving a first-line therapy, such as a corticosteroid, anti-D, or IVIG treatment, versus those receiving a second-line therapy, such as rituximab, a TPO receptor agonist, or other less common second-line therapies, such as dapsone, and even complementary therapies. To provide you with an overview, we found most participants received treatment for their ITP at some point. 43% were currently receiving treatment or had received treatment within the last 6 months. Most of the participants receiving treatment were receiving a monotherapy. The most common therapies reported included corticosteroids and TPO receptor agonists. Interestingly, more participants were receiving second-line therapies than first-line therapies. Separate from asking about current medicinal therapies, using registry data, we were able to show that 23% of adult participants reported they had a splenectomy in the past. Within the Adult Quality of Life Survey within the ITP registry, participants were asked how often does the participant feel tired overall, and how fatigued was the participant on average in the last 7 days. Response choices included never, rarely, sometimes, often, or always. What we found was that overall, a high number of participants reported overall tiredness and fatigue. In fact, overall tiredness was reported by over 85%. And when we look at how often these physical effects were experienced, often or always, over half the participants reported they felt tired, and 30% reported they felt fatigue almost always or often within the last 7 days. When stratified by treatment group, we still consistently saw a high number, over 80%, of participants reporting tiredness and fatigue, but differences between treatment groups were not found to be significant. The similar frequency of these physical effects among all the groups suggests that perhaps fatigue is not associated with treatment type. In summary, the most predominant first-line therapy used by participants was noted to be corticosteroids, and the most prominent second-line therapy was a TPO receptor agonist. Fatigue and tiredness are high among patients with ITP. However, we have not in this study been able to link fatigue and tiredness to treatment versus no treatment or a specific group of treatment. This suggests that platelet count and disease severity may not be the cause of these physical symptoms. In conclusion, active treatment does not appear to have an impact on fatigue or tiredness among adult patients with ITP, but the physical symptoms of fatigue and tiredness are a prominent burden for ITP participants. Reported fatigue and tiredness overall is high and needs further investigating, not only to understand its etiology, but also to find ways to reduce this burden for patients. Fatigue and tiredness could be related to living with a chronic disease that is often unpredictable in terms of symptoms such as bleeding. The multifaceted effects of ITP on patients' emotional and physical health often takes a significant toll and impacts their overall quality of life. We did not stratify by phases of ITP in this study as a next step that might be impactful. That concludes our poster presentation. Thank you for your attention.